Why does the auscultatory gap happen? Have you ever heard of the auscultatory gap? It's a term that might sound complex, but it plays a key role in blood pressure monitoring, especially for those managing hypertension. Understanding why this gap occurs can help ensure accurate blood pressure readings. The auscultatory gap refers to a temporary silence of sounds during blood pressure measurement. When the cuff is deflated, you might notice that the sounds produced by blood flow, known as Korotkoff sounds, can suddenly disappear. This happens between the systolic and diastolic pressures. If this gap is not recognized, it can lead to errors in reading blood pressure. For instance, it might cause a person to underestimate the systolic pressure or overestimate the diastolic pressure. So, what causes this phenomenon? One major reason is related to changes in the blood vessels and how blood flows through them. Specifically, conditions like increased arterial stiffness and atherosclerosis are often seen in patients with hypertension. These conditions affect how pulse waves travel through the arteries, leading to moments when the Korotkoff sounds vanish during cuff deflation. Additionally, peripheral vascular changes can play a role. If there are alterations in blood flow in the arm or leg where the measurement is taken, it can contribute to the auscultatory gap. This might include factors like venous stasis, which can affect how blood moves and how sounds are heard. Moreover, fluctuations in arterial pressure can also create different types of auscultatory gaps. Research has shown that these gaps can vary depending on how blood pressure changes during the measurement process. For effective hypertension management, recognizing the auscultatory gap is essential. To avoid misreading blood pressure, it is recommended to inflate the cuff to a pressure that is 20 to 40 millimeters of mercury above the point where the radial or brachial pulse disappears. This helps ensure that you capture accurate readings. When measuring blood pressure, palpating the pulse while inflating the cuff can help identify the maximum inflation pressure and detect any gaps. It is also important to document whether an auscultatory gap is present to ensure accurate blood pressure recording. Patients with hypertension are more likely to experience this gap due to the vascular changes associated with their condition. Correctly identifying and interpreting the auscultatory gap can help prevent errors in blood pressure measurement, which is vital for proper diagnosis and management of hypertension. While automated blood pressure devices tend to be less affected by the auscultatory gap, manual measurement remains important, especially when readings are inconsistent. By understanding the reasons behind the auscultatory gap, healthcare providers can ensure more accurate blood pressure monitoring and better manage hypertension.